the people of Mubende have understood what Ebola is, what needs to be done to prevent Ebola, and they have understood that it is extremely important to cooperate, report early, so that you can get treatment and you're discharged. We are having a little bit of challenges in Kasanda, one because of challenges with leadership and a very weak health system. But they are beginning to pick up, at least in the one last week or so. The population have understood that they have danger. They are saying they are ready to cooperate and to be supported. Then of course we have the Kampala metropolitan area, a very complex area that needs intense work, but needs extreme cooperation and understanding from the population. Because of being an urban area with lots of people living close together, we need to understand one another. Ebola is not difficult to control as long as people cooperate and understand what to do. But when we start playing hide and seek with each other, then that is when you have the outbreak blowing out of proportion. And so my humble appeal to the population is to understand the measures we are putting in place, to cooperate, report themselves early, and when asked to go under isolation or quarantine, cooperate and keep in there, rather than leaving your home and then we find you in Chikugo or Owino or in Kalerwe. That does not help. So that is a good picture of the outbreak so far.
Okay, that is on the outside. I want us now to have a picture of the inside of the facilities. I know we have all our treatment centers combined here in Kampala especially have about 200 and so beds, about 250 beds altogether.
Altogether, Walter, we have 350 beds for treatment of Ebola patients, because we have 3 isolation facilities in Mubende. One, we call it a withholding center in Madudu. It has 8 beds. Then the 2 separate facilities are 42 beds each. In Kampala, we have Entebbe, which is 67 beds, but also has 8 ICU beds. And then the Mulago one has 120 beds. That gives us a total of 350 beds when we have the Mulago isolation facility, which is the tent, constructed, and it will be a 64 bed. But also to let you know that we are putting up another isolation in Kasanda, so that will give additional bed space. Now right now I've just said we have 52 people in admission, both Mubende and Entebbe, undergoing treatment. The challenge with Ebola patients is that they stay for a long time, and that means you have to keep on expanding bed capacity if the population are not cooperating and you're getting more cases. But we see cooperation in Mubende, cases are going down. Cases are going up in Kasanda, they are beginning to understand. So our major focus right now will basically be on Kampala metropolitan area and ensuring that we have adequate bed capacity. But if people cooperate, then we will not need to expand bed capacity beyond what we need.
Yeah, and at the start of the outbreak we had some leaks into districts like Kagadi, Chegegwa. I don't know, were those just those cases, and what could have happened? There's no worry about the neighboring districts, now we're only worried about Kampala.
Of course, we still worry about the neighboring districts. You will recall that we categorized the districts into very high risk, and moderate risk. And Kampala Metropolitan was categorized under very high risk. Now, the very high risk districts at that time were the 5 affected districts of Kagadi, Chegegwa, Bunyangabo, Mubende, and Kasanda. Now, to date, we are relatively not worried about Bunyangabo and Kagadi. We had a case reappearing in Chegegwa, so we are still, carrying out our response intensely in Chegegwa. The other districts began their 21 days leading to the 42 days countdown. That doesn't mean we have withdrawn. The surveillance teams are there because anything can happen. Similarly, we cannot say because people in Mubende are responding, we are not worried. We are there. We are still there until we are declared free of Ebola by the World Health Organization. We remain extremely worried. The challenge with Kasanda is that as long as we don't have all the contacts where we want them to be, cases will continue appearing. Right now they have over 500 listed contacts, which is good for purposes of follow-up. But if a case appears somewhere else, then there are more contacts to list. So the 20 districts surrounding Mubende and Kasanda are still high-risk districts. Even with restricted movements, people still walk on foot. We know it is happening. We know people are crossing through to other districts. We know some have even crossed through and come to Kampala. We know that. So that is why we keep on emphasizing cooperation and understanding one another. Because when you run away, because you think you are running away from Ebola, and yet you're a contact case, you're actually running with the disease, and you will take it to the next place and take it to your family members. So people have to know that running away is not a solution. The solution is handing yourself over. And
at that point, it's very unfortunate actually. There's one case that came from Kasanda and ran to Kampala in Masanafu, and that one case has spread the infection to the rest of the family members, about 8 people. So it's quite your role and mine as well to see that we protect one another, protect your neighbor and protect yourself, because imagine what is happening to that family. That said, Honorable Minister, I'll come to you again shortly. Now I want to hear from the Permanent Secretary. The work is on ground, but your office is in charge of ensuring that the workers are actually on ground and doing the work. How do we look like in terms of human resource, basically finances, and PPE? These are things that we've been talking about days on end.
Yeah, as you know, Ebola is quite an expensive venture. If you have Ebola in the country, you know that definitely it requires a lot of resources. And so the government of Uganda, together with the partners, have been working together, first of all, to plan together from the time we got the outbreak, and then also to look at what is needed. The beauty is that we were just trying to get out of COVID, so we still had a lot of stocks of PPEs at national medical stores. So that kind of stock helped us to get started, but also partners like World Health Organization brought in more kits, and so we deployed. As far as PPEs are concerned, we are covered, and we continue to buy. Even right now, as I talk, we expect more stocks of PPEs in the country. The test kits, as you know, these are consumptive kind of consumables, so we continue buying. The human resource, we have deployed according to our pillars, the surveillance, logistic team, case management. They are all on ground, both in the isolation centers, but also in the field to trace. We have been able to mobilize some resources together with partners, because this, I will not say that we can do this alone. It is very, very expensive. The World Health Organization, USAID, UNICEF, MSF, and so many other have come on board to work with us. So we have deployed human resource. We have already made also the analysis of the additional, in case we get more numbers. We have already even secured approval from public service to recruit, and we are going to recruit more if there need be. And we don't want to take any chances, so we'll make sure that we prepare and we have the human resource that we need on ground. That's where we are now.
Okay, all right. Dr. Nanyunja here from WHO. The minister, in her words, said until WHO declares us free from Ebola. I want to start there. What does it take to be declared free from Ebola?
In order to be declared free from Ebola, the country has to declare no new cases in any of the districts, and would count 42 days with no new case among human beings, and then would declare this outbreak over.
Okay. And is WHO satisfied that we are on a good course in terms of containing and handling the outbreak?
I think that the government of Uganda, Ministry of Health and partners are on the right course in controlling of the epidemic. However, as mentioned, there are areas where we need to intensify. We need to do more, but one of the key issues that I see that is very critical in this response is cooperation by the community. The community needs to understand better. The community needs to be more cooperative. It needs to comply more to the public health measures to prevent the disease in order for this outbreak to be contained sooner than later in the country. But otherwise, the interventions are the right ones according to WHO guidelines. The pillars are all in place. The human resource is in place and more is being deployed. And the epidemic control structures are in place. The country is on the right course. If we have the cooperation of the communities, I think it will be successful soon.
Okay. So from the outlook, if you have just joined us, we are talking everything and anything to do with Ebola, the outbreak and the response and where we are. I have the Minister for Health, Dr. Jane Ruth Acheng, the Permanent Secretary, Dr. Diana Atwine, and Dr. Mariam Nanyunja from WHO as a Regional Advisor for Emergency Risk Management. And we are on UBC, Bukede TV1, TV West, and West Nile TV, and NTV as the host. From the outlook, I mean, the public outside can only follow the figures. We have 128 cases, 53 have recovered. I mean, sometimes we see difference in these cases. For example, from WHO and what our own Ministry of Health is publishing. What causes that kind of contrast? And probably Dr. Cheng, you will want to explain.
Well, Walter, you know, during epidemics, what we emphasize is a good collaboration and transparency. The government of Uganda is reporting very accurately on confirmed cases, because those are the cases where we are 100% sure that they tested and were confirmed to have Ebola. The World Health Organization adds in probable cases. Probable cases are cases that died in the community, and during investigation, you kind of tend to link them to cases that later on you confirmed, and we assume that they probably died from Ebola. Currently in Uganda, we are also having a malaria epidemic, and so we want to be extremely sure, because we have had people being brought to the isolation facilities with signs and symptoms similar to Ebola, but later on when we test them, they are actually negative. We test them again, they are negative and positive for malaria. So to be very clear to the population, we want to stick to reporting confirmed cases. But because it is a WHO policy and we are working in collaboration, we don't refuse them to report the probable cases, because probable may actually have been cases of Ebola or cases of any other thing.
Okay, so Ebola is not new to Uganda. I mean, the very worst outbreak we've had in the country was in 2000, and interestingly it was announced on the 8th of October. We lost about 200 plus people during that outbreak in Gulu. So which means we have, you know, some capacity and some skill, and for those of you who may not know, we have surveillance teams on our borders with Congo, especially 24/7, trying to look through for anything that may look like Ebola, because Ebola is endemic in, I would say, Africa, but majorly in DRC. And it wasn't new information that we have Ebola in the country. But I want to hear from the PS regarding the health workers. Do we have enough people who are trained in handling Ebola right now, or are we, you know, training more? How many numbers are we looking at?
You've said it rightly. We have had several episodes of Ebola in the country, and not only Ebola. We have had other hemorrhagic fever-related diseases. We have had COVID, and through all that, our human resource has built capacity. And I also want to say that Ebola is not really something abstract, because the symptoms, even the treatment we are giving Ebola patients, we actually give supportive treatment. If someone comes with fever, we treat fever. Someone comes with vomiting and diarrhea, we treat that. If they are bleeding, we give blood, we rehydrate, and slowly the immunity picks up. So it's not, we are not talking about something so complicated, but it gets complicated because of the nature of the disease and because it is highly infectious, and that's what makes it more complicated. But otherwise, our human resource is able. We have built capacity. It's not the first time. We continue to train. We have got our well-elaborate structure right from the Ministry of Health to the district, through DHTs up to the VHTs and the grassroots. So we are able to do surveillance, because I think epidemics, the success of how to deal with epidemics lies in the strength in surveillance. If you are able to prevent the numbers, then you are able to defeat the disease. I think from the history of Ebola, what happened to elsewhere in Africa was the gaps in surveillance and controlling. So Ebola per se as a disease, there is no special treatment. Of course, now we are venturing into new ways of treatment. That's why we have monoclonal antibodies. That's why we are now testing to see whether this other antiviral drug that we are using in COVID, whether it can also help in Ebola. We are using remdesivir. So we are just treating symptoms. But the strength of Uganda, the strength of the health system in dealing with Ebola lies in collaboration with the partnerships that we have in the country, lies with strong surveillance system. That's where really the strength lies.
And in terms of numbers, how many health workers are we looking at for this response?
Because we have different, we have district teams already in the district. I don't have the numbers. We have also our center teams that we have deployed. We have partners. I need to really to compute, but it's a huge number, and we have already obtained a clearance to recruit more additional 1,000 people. So the numbers are big, but I have to sit down and get all the partners and know the people who are on ground and compute, but there are many.
Okay. All right, so in West Africa, one of the challenges they pointed out, I mean, reports that were compiled by monitoring bodies, including WHO, one factor was that once the outbreak reached the town, then it became a problem. We have Ebola in Kampala, which is the capital city. I mean, there's a scare. Everybody has something to say about Ebola. Even those who know, even those who don't know. I mean, everyone has something to say. But we would like to know the fact that we have some cases in Kampala. I mean, it's nothing to hide anymore. How are we handling, and how should we handle as Kampala? Some schools I've seen at least some circulars stopping school visitations. How are we handling? What is the guidance from the ministry? Dr. Chen.
Walter, definitely we have Ebola in Kampala. 3 divisions are affected. Rubaga, with the highest number of cases, about 14. We have one in Makindye, one in Kawempe. We also have Ebola in Wakiso, in Nansana and Masanaf. So we are not hiding any cases of Ebola. We have had schools affected. We have 1 school in Wakiso, 3 schools in Kampala that have been affected. Now, if you go back to what we have been telling the population, anybody who has had contact, report. Anybody who has developed signs and symptoms, report. Now, when you keep quiet, when you have had contact, like happened to that family, and here was an uncle all the way from Kasanda, comes to visit the family, and yet we are already talking about Ebola. If they had spoken early, perhaps we could have prevented the infection from spreading. But they did not. The children were affected. We thank God that they have improved, but obviously the neighbor lost a child in the process. So what is extremely important is for us, the communities, the parents, the teaching staff, and the support staff in the schools to create a safe working environment in the schools. How do we do it? Temperature screening is mandatory. Hand washing. Children should be encouraged. We can take it as a game. Wash hands all the time with soap and water, because the virus is fragile. You wash your hands with soap and water, it will die. And soap is available, and water is available in the schools within Kampala. It is extremely difficult for children to maintain their social distancing. But if we have infection prevention materials, we have JIC, we have chlorine solutions, we ensure that surfaces are cleaned, the lavatories are clean, the toilets are cleaned and disinfected frequently, then we can be relatively sure that our children are in a safe environment. But any child who falls sick at school should be reported immediately so that the child is evacuated for testing. Any child who misses school, we are interested in knowing what is happening to the child, just like we've been doing to schools in Mubende. For your information, one school in Mubende had a child who turned positive, but because of the vigilance that was put in controlling that infection and making sure that more don't get infected, we never got any secondary cases. Similarly, it can happen in schools in Kampala. The permanent secretary recently in one of her addresses called out to schools to ensure that they follow the standard operating procedures during this time until when, you know, children do exams and go home. However, it would be extremely nice if Minister of Education considered early exams, so that then we are left with only the candidates, because we know that the time frame for candidates to do their exams has already been fixed. But the fewer learners at school, the easier for us to carry out surveillance and ensure that they are safe. So our message is to all the parents, is to all the teachers and the support staff. Visitation currently is not necessary. In any case, exams are ongoing, and visitation can cause a distraction in whatever is happening. That is one. Two, follow the standard operating procedures and report. And we do hope that the head teachers will be very vigilant in reporting any case that has signs and symptoms similar to Ebola.
Okay. All right, Dr. Mariam Nanyunja from WHO. We want to hear from you regarding the way countries relate if we have an outbreak. For example, now we have Ebola. We had countries like Kenya and South Sudan, at least those I saw, written documents over time, alerting the public there to avoid or report any suspected case. What is the policy there? What's the guideline? If a country has an outbreak, how do they deal with the neighbors? Because, business must go on. Travels cannot stop until maybe a certain time when it's very risky.
Yeah, thank you, Walter. One thing that we need to know is that as neighboring countries, there's a lot of interactions between countries. Across the borders, some borders are porous, but also people have relatives across the borders, and others cross the borders for business and other reasons. So there's always cross-border interaction, and so the risk of the disease being transferred from one country to another is really possible. So the countries, under the guidance of Africa CDC, WHO, East African Community, and IGAD, recently had a meeting here in Kampala, which brought together the ministers of health of the 6 countries that are surrounding Uganda together with Uganda, and they agreed on a framework for collaboration between the countries. And they agreed to share information on cases that cross from one border to another, or contacts that cross from one country to another. They agreed to support each other if we need help and we are out of human resource. Luckily not yet, we can even call upon people from Kenya or Tanzania to come and assist us. They agreed on doing surveillance on their side also, so that they can detect any cases that could be imported from here to their country and contain the outbreak there. So there is a cross-border collaboration in this containment of the outbreak between the countries around. And each of those countries has developed a readiness plan. They are ready to handle Ebola if it crosses to their countries. But they are also ready to come and assist us as neighbors in case of need.
Okay. For that matter, there's a document that I saw about 2 days ago, and from the Ministry of Health, indicating that all contacts will not be allowed to travel, whether locally or internationally, for 21 days. Yeah, so I guess you see how uncomfortable it will be if you dare contract Ebola, or if you're a contact. So stay safe and keep yourself safe. But Honorable Minister, how did you reach this decision?
About contacts not traveling.
Yes, someone out there would want to know how does it work out? How does it help?
Well, Walter, it is extremely important that if you're a contact, you stay put. Earlier on, I clearly elaborated that if you're a contact, we have to follow you up for 21 days, because on any of those days, you may turn positive, even on the 18th, 19th, or the 20th day. So you cannot assume that you've gone 10 days and you are completely safe. Now, we know that Ugandans travel. Many people have been traveling for various reasons, and we have a huge number of Ugandans traveling because of labor externalization. So to be extremely sure that we don't export any contact with Ebola who may turn positive in another country and continue spreading the infection, we have communicated very clearly in the travel advisory. Don't travel, stay put. Now, for us to follow up, of course, we have to work very closely with immigration, because we know the people, we have the contact list, and we can follow that up. But also it gives reassurance to our partners and many other countries that, you know, are worried. Recently you saw some of the travel restrictions that were imposed by the US government. You can only go to certain airports, you can't go to others. And sometimes where you are landing is extremely far from actually where you want to go. So it gives them a degree of comfort that Uganda is being extra careful to ensure that we contain the outbreak where it is. But it is also part of the International Health Regulations 2005, to which Uganda is signatory. And in there, as a country, we have committed that we will try as much as possible to ensure that we don't export any infection. So it is a call out to Ugandans. If you know you have had contact, if you are listed as a contact and you were scheduled to travel, including the health workers, please don't travel. Just stay within your country. We follow you up. If you are negative after 21 days and you are, you know, removed from the contact list, then you can travel. If you're not removed from the contact list, you still remain, I don't want to say restricted from traveling, but quarantined within your country. Yes.
Okay. All right, Doctor.
In your home.
In your home.
Yes. Dr. Twine, who is doing this contact tracing? I mean, we're talking about looking for people from all over the country.
In each district we have the structure, the task force, but also the health teams in that particular district. But also they are being supported by the central team that is coming from the Ministry of Health and partners. And the district teams also are working with the VHTs, because the VHTs know better their villages. And so if there is any particular case in that particular village, the VHTs are the first one to know. And so they are very, very critical in providing us with information. And then they link up with the district teams together with our central teams. That's the structure, that's the chain of command. I wanted to add on what should we do in Kampala. She was talking about the school, but also we need to know that like in Kampala, where we have so many people, they come in and go out of Kampala. It is a business center. We have a huge community of business people. We want to see the corporate world embrace SOPs for Ebola. We want to see hand washing in the banks or sanitizing. We want to see temperature taking, because the beauty about Ebola, unlike COVID that would spread even when no one had symptoms, Ebola can only spread when you have symptoms. And therefore, if we do just two main things. First is to make sure that we detect the symptom early. How do we detect symptom early? We check the temperature. If you're going to the bank, if you're going to the market, if you're going to any function, and just a simple gadget is able to pick at earliest possible time when you have the fever. And the fever is the first symptom normally to present. And so if at that stage, if one is picked, then you avert that whole chain of infection. So we want to see the community in Kampala, the business community, the corporate world, to start implementing all these SOPs. And it is good. It's not just for Ebola. We saw in the time of COVID, the diseases that were related to hygiene dropped significantly. And so we really want to see that culture pick up and we continue. But right now, for survival, for protection of our country, for business, we need to institute those measures in our workplaces.
Okay. All right. I have a question here for you. And this is actually the president of medical interns, Dr. Musa Lumumba. He says, actually ask Dr. Diana and Dr. Cheng why they have taken long without paying medical interns allowances for September and October, yet they are frontline healthcare workers at a time Uganda is dealing with the Ebola epidemic.
Oh, I can lay anxiety of Lumumba. The money was sent. The money was paid. Maybe the facilities have not yet received it on their account. You know, our payments first goes to finance, Bank of Uganda to the facilities. Possibly it must be around that, but on our side we paid. So they should be able to get that money. Yes, it is true that we did not get the money is released in quarter. So the money that we got in the last quarter was for 2 months. And even this quarter we received for 2 months, but I'm in touch with finance. I just want to allay the anxiety. Minister of Finance has committed that even the remaining resources will be released. But for now, they will get their money.
Yeah. During COVID-19, we saw the UPDF coming to give a hand. Do we have some health workers from the UPDF?
Oh, yes. We have always worked with UPDF. UPDF is a force that is always ready. While some of us in our government, in other government entities, we have certain strict bureaucratic processes. When we have an epidemic, UPDF is always at hand. They are always fast to deploy, and so we work with them very well, and even right now we are working with them. So every epidemic, every incident that requires their input, they will always be available for us.
Okay. All right, so we have about 4 minutes, but I want to hear from you regarding the emergency plan in terms of financing.
Okay.
Where do we stand?
Emergency plan was costed. It was costing about 76 billion. But as we go along, we've been spending money, and the partners have been spending money. We'll have to come back and see where we are in terms of resources that we have mobilized, but also how much we have spent. But we have already also put our request to finance. They're working on our request. You know, it has to go through that whole whatever the law, the financial laws that govern our disbursements. It has to go through Parliament and all that. But in the meantime, we've had to find money within, which we are using together with the partners. I need to really to compare. I'd have, but it is beyond 4 billion now.
Okay. All right, and at that point, Dr. Acheng, I want to hear from you about the emergency plan, not just looking for money when we have an emergency. Are we able to develop our own emergency plan as a country and probably have funds in it? Do we have something like that in existence?
You ask a very important question, something that we have been discussing for the last 10 years. Readiness, not only in terms of human resource and systems, but readiness in terms of money that you can easily pick and respond. I will tell you that we are not yet there, but we have made progress. After having discussed the issue at length, His Excellency gave a go-ahead for us to go to create a National Institute of Public Health bylaw. And we are looking at having this Institute for Public Health with its own account that can respond. But obviously there will be challenges because we have other laws that were created in this country, especially the Public Finance and Management Act, that does not allow any money to remain in in any account at the end of a financial year. It has to go back into the consolidated account. So we are still at that level of negotiations and so on, and bringing this to the attention of Parliament. They need to understand that outbreaks are always unforeseen. You don't plan them. You don't know they are going to happen. So it is just extremely important that we are always ready with resources, finance, human, the systems, the laboratories, and everything. And until we get to that level, we will continue to have challenges like the PS has been highlighting, requesting for supplementaries, which is not a smart way of doing things. The smart way is to be ready. An announcement is made, we respond. Together with partners, we are working on that.
Okay. All right, very quickly, Dr. Mariam, about the vaccine. Sudan has no known vaccine for now, but we have supportive treatment. Should we hope for a vaccine?
Yes, Walter, you're right. There's no vaccine for Ebola Sudan strain, but there are efforts that are ongoing to study the availability of a new vaccine for Ebola Sudan. There are about 2 candidate vaccines that have been tried at phase 1, and they are promising. So there are proposals to try some of these vaccines here. They are under a clinical trial arrangement. WHO is supporting, and the country has identified qualified scientists to lead this process here in the country. And if they get approval and it's done, maybe we may get more information on probably a useful vaccine for Ebola Sudan by the end of this outbreak.
Okay. All right, thank you very much. My panelists, Minister for Health, Dr. Jane Ruth Acheng, the PS, Dr. Diana Twine, and from WHO, Regional Advisor on Emergency Risk Management, Dr. Mariam Nanyunja. From wherever you watched us from, UBC TV, Bukede TV, TV West, West Nile TV, or NTV, online, or maybe you follow the hashtag. Thank you very much. The only takeaway for you and me is, first of all, report any suspicious cases, but stay safe. Keep yourself and your family safe and your neighbor safe, and cooperate. If you're listed as a contact, please adhere to the guidelines that you're given, right? That said, we will end it here. Probably we'll have another time next time to have such a conversation and more of your questions shared or responded to. My name is Walter Mwesije. Stay safe and have a good evening.
The Ministry of Health informs the public that there are confirmed cases of Ebola in Uganda. We, however, urge the public not to panic as the situation is being managed. The Ministry of Health further reminds the public to be on the lookout for any persons who may show signs and symptoms of Ebola. These include high body temperature, abdominal pains, diarrhea, vomiting, bleeding from the body openings such as the nose, eyes, and mouth. Please inform the the nearest health worker immediately if you see anyone with these signs and symptoms. To prevent Ebola from spreading further, please take the following preventive measures: regular washing of hands with water and soap, avoid handshaking and hugging, avoiding any contact with any suspected Ebola patients. Any person who dies suddenly should not be buried but reported to the nearest health worker or LC1 immediately. For further information, please call the Ministry of Health toll-free number on 0800-100-066 or send a free SMS to your report on 8500. This message is from the Ministry of Health with support from UNICEF and World Health Organization.